Trandolapril is a prodrug of an ACE inhibitor used to treat hypertension, congestive heart failure, and to improve survival following a myocardial infarction. In this video, let's found. What is Trandolapril? What is Trandolapril used for? Contraindication. What are the side effects of taking Trandolapril? How does Trandolapril work? How to use Trandolapril? What is Trandolapril? Trandolapril is an ACE inhibitor used to treat high blood pressure. It may also be used to treat other conditions. It is similar in structure to another ACE inhibitor, ramipril, but has a cyclohexane group. It also is a prodrug and must get metabolized. It has a longer half-life when compared to other agents in this class. It was patented in 1981 and approved for medical use in 1993. It is marketed by Abbott Laboratories under the brand name Mavik. What is Trandolapril used for? For the treatment of mild to moderate hypertension, as an adjunct in the treatment of congestive heart failure, CHF, to improve survival following myocardial infarction, MI, in individuals who are hemodynamically stable and demonstrate symptoms of left ventricular systolic dysfunction or signs of CHF within a few days following acute MI, and to slow progression of renal disease in hypertensive patients with diabetes mellitus and microalbuminuria or overt nephropathy. Contraindication. Trandolapril is contraindicated in people who have diabetic patients who are also taking aliskiren, Tecturna, or hereditary or idiopathic angioedema, or patients who have kidney problems and are also taking aliskiren should not be used in patients with these conditions. Side effects. Trandolapril use can result in blurred vision, confusion, difficulty with breathing, dizziness, faintness, or lightheadedness when getting up suddenly from a lying or sitting position, fainting, irregular heartbeat, nausea, nervousness. Pharmacodynamic. Trandolapril is the ethyl ester prodrug of a non-sulfonyl ACE inhibitor, trandolaprilat. Trandolapril is deesterified in the liver to the diacid metabolite, trandolaprilat, which is approximately 8 times more active as an inhibitor of ACE than its parent compound. ACE is a peptidyl dipeptidase that is part of the RAAS. The RAAS is a homeostatic mechanism for regulating hemodynamics, water and electrolyte balance. During sympathetic stimulation or when renal blood pressure or blood flow is reduced, renin is released from the granular cells of the juxtaglomerular apparatus in the kidneys. The blood pressure lowering effect of trandolaprilat is due to a decrease in peripheral vascular resistance, which is not accompanied by significant changes in urinary excretion of chloride or potassium or water or sodium retention. Mechanism of action. ACE inhibitors bind to and inhibit the activity of both domains, but have much greater affinity for and inhibitory activity against the C domain. Trandolaprilat, the active metabolite of trandolapril, competes with ATI for binding to ACE and inhibits an enzymatic proteolysis of ATI to ATII. Decreasing ATII levels in the body decreases blood pressure by inhibiting the pressor effects of ATII as described in the pharmacology section above. Trandolaprilat also causes an increase in plasma renin activity likely due to a loss of feedback inhibition mediated by ATII on the release of renin and/or stimulation of reflex mechanisms via baroreceptors. Half-life. The elimination half-lives of trandolapril and trandolaprilat are about 6 and 10 hours, respectively, but, similar to all ACE inhibitors, trandolaprilat also has a prolonged terminal elimination phase that involves a small fraction of administered drug. This likely represents drug binding to plasma and tissue ACE. The effective half-life of elimination for trandolaprilat is 16 to 24 hours. Dose. The dose of this medicine will be different for different patients. Hypertension. In patients not taking a diuretic. Initial dose. 1 mg POQ in non-black patients. 2 mg POQ in black patients. Maintenance dose. 2 to 4 mg POQ may divide Q12HR if BP response diminishes. Congestive heart failure or left ventricular dysfunction post-MI. Initial, 1 mg POQ. Maintenance, 4 mg POQ. Safety advice. US FDA Pregnancy Category D. There is positive evidence of human fetal risk based on adverse reaction data from investigational or marketing experience or studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. AU, use is contraindicated. That's all the information about Trandolapril we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.